Hoarseness is a symptom that most patients have experienced at one time in their life or another, even if it was only for a few days during a bad cold. When hoarseness lasts for longer than a month, we will often have a referral to an ENT physician to look into the ultimate cause, and some of those cases have been going on for 6 to even 12 months. Generally, I break that diagnosis down into 3 major categories. Hoarseness that arises from inflammation, hoarseness that arises from a lesion of the voice box, or hoarseness that arises from how the voice box is controlled by all of the small muscles of the throat. Hoarseness that arises from inflammation is the most common type. Think of your simple case of laryngitis that might follow an aggressive cold. When we see patients that have inflammation of the vocal cords, in the office, we might use a small camera to look at that voice box and see the anatomy and how it's performing. And depending upon the pattern, we will tailor a symptom treatment plan to help resolve that over the first 1 to 3 months. One of the diagnoses that we will come up with could include an anatomic lesion leading to hoarseness. More commonly, we could see a small polyp or even a nodule, such as a Singer's nodule, that gets in the way of the vocal cords coming together and ultimately leads to that hoarseness. One category of hoarseness diagnoses deals with how the vocal cords are controlled. If we learn to squeeze the voice box too firmly, it will lead to a strained or hoarse quality of voice. Many of the conservative plans that we will lay out to start before any surgical intervention for the voice box would rely on a speech therapist to work on speech patterns and sometimes retraining how we speak over the first 4 to 12 weeks in some cases. We will often receive consults for the elderly population on changes in vocal quality. Now, sometimes we will see the anatomy change similar to how the skin quality can change as we age. Well, with the precise movements of the vocal cords, a change in volume can sometimes alter the quality of the voice. And that can be treated, whether through physical therapy in the form of speech therapy, or surgical intervention in some cases. If you have any other questions on hoarseness or vocal quality in general, please reach out. Give us a call, we'd be happy to help.